Hello. Thank you for visiting our medical physics residency YouTube channel. My name is Nilendu Gupta. I'm the program director for the residency program and also the vice chair of medical physics in our department. I wanted to provide you a very brief summary of one aspect of our program, and then my colleague Jeff Bullard, who's our associate program director, will also provide another video with the rest of the information. So I will talk a little bit about your virtual interview process for our residency program and give you a little bit of a overview of the university, the cancer program, and introduce our department to you, as well as talk about some of our teaching and research activities, and also introduce our medical physics team. And then Dr. Willard will talk about the residency program overview, as well as rotations and some of the didactics. And as we talk through that, I do want to make sure we give a shout out to Marcy Sparks, who's our education coordinator, and Meg Decker, who's our education manager, who are really key in having a program that has been run over the years. We've run it very efficiently. So talking about your virtual interview schedule, we essentially will be interviewing 2 blocks per day and over 2 days, and trying to get through a whole group of candidates. Marcy will send you information about the department, the residency program, as well as the YouTube channel link ahead of time. Our virtual interviews will be on the Zoom platform, and we hope to have 8 interview slots, maybe down to 7, with individuals or groups of 2 interviewing you throughout your half day. We do plan, and our residents usually manage this, a virtual happy hour the night before. And then our typical scheduled slot is 15 minutes for interviews, and then a 5-minute turnover time with a short break to allow you to transition from one interview to another. So hopefully that'll allow you to meet a pretty decent group of folks within our group, as well as give you a good opportunity to get questions answered along the way. Let's talk briefly about the university. The Ohio State University is one of the largest campuses with a huge patient student enrollment of 67,000 in 2024. And I won't go over all the statistics, but when you review these slides, you can see a lot of the interesting statistics that we have put together about the university and the breadth and size of the program. Of course, we are known for our football program, and we were the national champions in 2024, and the James, which is our cancer program, is really very well recognized and revered in the university. And here you see our band which is famous for all the script they do during their band performances, have basically has a script of the James. This actually happened during our opening of one of the main cancer program hospital in 2014, and we really cherish having that. The James Cancer Hospital itself, this building that you see in this slide is our current main campus building. It was built in 2014, or opened in 2014. It was a $1.1 billion project, and really allowed us to grow and expand not only our cancer program, but the radiation oncology department as well. And we were lucky to get a huge federal grant as part of this to really help expand us and be a radiation oncology department in the 2nd floor, which is a very unique opportunity for including our vaults and everything. Now, the cancer program, which is the James Cancer Hospital, is our clinical arm. We also have a whole comprehensive cancer center that's associated with that. And the whole cancer program is attached to, of course, the Ohio State University, Wexner Medical Center, and the University College of Medicine as a whole. And the cancer program, clinical program, is colloquially called the James in this region, and everybody knows us as the James. It's one of 45 NCI designated comprehensive cancer centers, and we've had this designation since 1976. We are one of 3 that rated excellent programs by the NCI during its last review. And there are a lot of other statistics, including the number of beds and so forth below, which I won't go through the details of, but please review them at your leisure. One of the key areas that we've really focused on is generating funding for our research team members. And one of the biggest charitable events we host, and regionally is very famous, is called Pelotonia, which is a bike ride. And you can see in the statistics below how much of funds were raised over the years. So as of 2024, our totals since 2008 is close to $310 million that were raised for just cancer research within the James. So that really funds a lot of research and development programs within our organization. Our radiation oncology department is also very large. We have about 24, and I think maybe a little more than that now, clinical physician faculty and 1 outreach physician. We have residency education programs in radiation oncology and medical physics. We have a therapist training program, which is an undergraduate degree program, and dosimetry training program as well, where we are a clinical site. And we have about 14 lab-based PIs in the department who are research faculty in essence. The leadership of the department consists of my boss, our chair, Dr. Chakrabarty, who joined us in 2009. And shown here are some of the key administrators on the clinical side. We have several other vice chairs and administrators on the research side, but our vice chair for clinical and translational research is Dr. Jawar. Dr. Blakai is our vice chair for clinical operations. Dr. Ravel is our residency program director for our radiation oncology residency. I lead the physics residency, as well as I am the vice chair for medical physics. And then Julie is our department administrator. One of the key kind of things that I wanted to share with you is the huge growth in patient volume that we have experienced over the past 15 years or so. And that has really been the key for how we've expanded and continue to provide expanded services and all the new technologies we have. So this is a huge growth that you'll see in this graph. Just wanted to quickly show you, can't go through everybody's name, but in this slide and next is a slice of all our current physicists, and we have basically faculty and staff physicists as well as physics assistants in our team. And please feel free to review these and go through all of them, their names and what they do. We have some physicists subspecialized in protons, and I'll go over those numbers a little later during towards the end of the presentation. Just to give you an idea of how and where we operate, the map on the left is a map of Central Ohio, and you can see Columbus and the 270 loop, which is our kind of outer loop. Shown are locations where the cancer program has different presences. However, we only are present really around main campus, and I'll show you a more blown up graph later on. But we do cover a clinic in Worcester, Ohio, which is kind of closer to Cleveland than Columbus, actually, as part of our coverage model. Most of the busy locations we have, the bigger locations, are right around main campus. So this is our cancer hospital building, and adjoining to our building, we have a brain and spine center where we have some presence. And then we have two outpatient locations, one at the Stephanie Spielman Comprehensive Breast Center and the James Outpatient Care. These are all within like a mile or mile and a half from our main campus operations. And that's where the hub of all our activities are. So just going through these locations, the James Cancer Hospital shown on the right is our main campus location. It has 6 LINACs, 3 TrueBeams and 3 edges, 1 ethos that is about to go live now. We have 1 intraoperative radiotherapy LINAC, which is the Mobitron. We have 2 CT simulators, a Siemens and a GE, 1 MR simulator, which also is our procedure MR, attached to our brachy suite. We have a very robust brachy program with a large brachy suite with the Bravos HTR in-room CT and the MR that's right next to it. And we use ARIA and Eclipse mainly for our main campus operations. In the brain and spine building, which is really adjacent and joined to the main cancer building down a couple of buildings, we have our Gamma Knife icon. And then we have our research and training systems out there as well that we briefly talk about. In fact, our Gamma Knife icon is in the process in the next, this calendar year to get upgraded as well. At the Stephanie Spielman Comprehensive Breast Center, we have 2 TrueBeams and a CT simulator in a dedicated breast building where we have all the different breast kind of specialties under one roof. And then recently we opened the James Outpatient Care where we house our proton therapy system, which has 2 gantries, 1 fixed beam room. We do have a TrueBeam Edge there. We have 1 shelled LINAC vault, which has been approved to install the reflection system later this year. And we have 2 CT simulators from Siemens. And then in that location, we use ARIA Ray Station and Eclipse, Ray Station for protons and Eclipse for our photon operations. And then the Worcester Community Hospital is the one in Worcester, Ohio, that we do not own, but we operate with our provide services with physician, physics, and dosimetry. It has 1 LINAC, which is a variant vital beam, and a CT simulator made by GE. This graph actually shows you, and there'll be another one that shows some more, just the growth in not only our patient volumes, but it's broken down by types of treatments we offer. So like most places, you'll see a pretty large growth in our IMRT volume and our SRS SPRT volume, while I think our 3D volumes remain largely constant or just been kind of reduced a little bit. Also shown here are some graphs that I won't spend too much time. This is just showing each of the different modalities and how they have grown and how they have kind of reduced over time as well. But also interestingly, what we see nationally is a trend towards hypofractionation. So our average number of fractions for different types of treatments have dwindled and or become less, and the overall fractionation for our patients, averaged overall patients have also reduced, which is, I think, a trend seen everywhere. I won't go over all these numbers, but just to give you a flavor of what all we do, if you look back 1 year, we had about 5,768 treatment plans that were approved for our photon operations in 1 year. This does not include our proton plans. And then if we look at, again, this shows the same number, but it shows it by disease site breakdowns. Again, I won't go through these, but just wanted you to have these just as a snapshot to look at. And finally, in the same look back, we had about 1,398, close to 1,400 SRS SBRT plans that were performed, showing also the breakdown by disease site. In terms of some specialized services and programs, we have, of course, proton therapy is one of the recent ones, and that's a huge new addition to our department. We are a very high volume brachytherapy service. We offer cardiac SPRT, which is done through an IDE-based trial, as well as a humanitarian use clinical trial. We had an intraoperative and a radiotherapy through electron beams and IO-HDR for many years now, and that's a very unique service that not every location has. We have 2 electron flash preclinical devices that we have a robust flash research program. We also have in our proton system a non-clinical fixed beam room for flash research that is about to go live with flash work as well. We also have something very unique. We have a non-clinical TrueBeam within our radiation oncology department that does not treat patients and is part of our radiation oncology training center that allows us to do a lot of unique things in both teaching and research with a LINAC. And then, of course, I did mention that we do have the proton flash work that's starting in the proton beam line. We've heard that we have a gamma knife as well as multiple TrueBeam edges. Our gamma knife has really been evolved into a lot of pre-op SRS for brain mets, which are kind of procedures that are done in very short notice, as well as a growing radiosurgery program for benign and functional disorders. And we also completed our first SRT on the LINAC for a spasticity trial, which is a very interesting benign condition that we treated for the first time. In terms of our team members, of course, I mentioned before that we are on the medical physicist group. We have faculty and staff physicists, some of whom are proton specialized. We have MPA program where we hire medical physics assistants. We have our residents, as well as, of course, broader part of our team is the dosimetry colleagues, as well as radiation oncology IT that reports through physics. So currently we have 11 faculty physicists, 20 staff physicists with 4 leads among them, and about 6 vacant positions. 8 of the above are proton specialized faculty and staff. And our proton group is led by my colleague, Dr. Ayan, who is our chief of proton physics. We have 4 medical physics assistants, 4 medical physics residents right now, and we are hoping to grow that to 6, 3 per year. And currently we have 9 radiation oncology IT staff members. Our dosimetry team is led by our dosimetry manager, Robin, who's a medical physicist in my group. And we have 1 assistant manager, Wes Zoller, and soon we'll hire a second one. We do have 5 lead dosimetrists that essentially help manage the dosimetry team as well. A total of 25 dosimetrists, 19 assigned to our photon operations and 6 to our proton. And we have 13 dosimetrists on main campus, 3 at the breast center, 6 at the outpatient care for protons and 2 for photons. And then we have 1 dosimetrist at our outreach location assigned there. In terms of our education programs, we have education programs in radiation therapy, which is an undergraduate program. We have several of my colleagues that participate in undergraduate research experiences for our undergraduate students at Ohio State, and that's becoming very popular. We have a dosimetry training program through, we are a clinical site for University of Wisconsin at La Crosse. Our physics residency program, of course, has been there for a while, as well as our radiation oncology residency program. We do have several fellowships, and that keeps growing in CNS, brachytherapy, and head and neck IORT right now. As I mentioned, we have an international training center for radiation oncology, which hosts visitors and collaborators around the world for clinical and research experiences. And then we also offer a whole lot of clinical schools in different areas for clinicians all around the country. As I mentioned, we do have this non-clinical TrueBeam and already listed some of the uses, but in essence, for the physics residency, that's a humongous resource that our residents really exploit very successfully to improve their learning and their ability to walk up and do all kinds of things during the day, which is not very commonly possible in most places. We have a lot of research involvement, and several of our faculty and staff physicists are involved in various things, and our residents get involved in many of these as well. So on the basic science side, we have a lot of work going on FLASH, as I mentioned. So we have some FLASH physics research as well as some preclinical research we're involved with. We get involved with various clinical development projects, and the most recent one we did was a project with Varian on hypersite research, which has now led to a clinical trial that's about to open. And we have clinical trials, a lot of them. We participate in cooperative group trials, multi-institution trials, and investigator-initiated trials, several of which are run through our physics team as well. So in summary, we've really transformed our team into a lot of growth, but also we've focused on disease sites and tried to create a stronger experience of treating complex cases with a team approach. Our medical physics and dosimetry teams have been key players in delivering our three-part academic mission, which is clinical service, research, and teaching. And our programs have grown strongly over the past decade, and we continue to plan expansions and over the next decade of growth. And I welcome you to kind of get more information and then also listen to the next presentation by my colleague, Dr. Willard. Thank you so much, and I hope to meet each and every one of you over the next few weeks. Thank you.